Understanding ticks and why they're dangerous. Ticks are one of the most common external parasites that dogs encounter, especially if they spend time outdoors in grassy areas, forests, or even backyards. These tiny arachnids feed on blood and can transmit serious diseases such as Lyme disease, ehrlichiosis, anaplasmosis, and Rocky Mountain spotted fever. Unlike fleas, ticks don't jump onto your dog. Instead, they crawl onto them from tall grass or shrubs and then embed their mouth parts into the skin. Once attached, ticks can remain for hours or days, feeding and potentially releasing pathogens into your dog's bloodstream. Some species are so small in their early stages that they can be hard to detect, which makes regular inspection essential. Symptoms of tick-borne illness include lethargy, fever, loss of appetite, lameness, or swollen joints, but sometimes dogs may show no signs until the disease has progressed. That's why early detection and prompt removal are critical. Knowing what ticks are, how they behave, and the risks they carry is the first step in protecting your dog and responding effectively if you discover one. If you want more proven veterinary-backed guides to keep your pet safe and healthy, remember to subscribe for weekly updates, how to check for ticks and remove them safely. If your dog spends any time outdoors, you should perform a tick check daily, especially during warmer months when ticks are most active. Start by running your hands gently over your dog's entire body, feeling for small bumps around the ears, neck, under the collar, between the toes, in armpits, groin, and tail area. These are the most common hiding spots. When you find a tick, removal must be done carefully. The safest method, as recommended by veterinarians and the CDC, is to use fine-tipped tweezers or a special tick removal tool. Grasp the tick as close to the skin's surface as possible and pull upward with steady, even pressure. Do not twist, jerk, or squeeze, as this can cause the tick's mouth parts to break off and remain in the skin, leading to infection. Never use remedies like burning the tick with a match, covering it with petroleum jelly, or using essential oils. These methods are unsafe and may cause the tick to release more pathogens. Once removed, place the tick in a sealed container with rubbing alcohol in case your vet needs to identify it later. Then clean your dog's skin with antiseptic and wash your hands thoroughly. Tick removal may feel intimidating at first, but with the right technique, it's quick, safe, and painless for your dog. If this step-by-step breakdown is helpful, don't forget to like this video and subscribe for more practical pet health tutorials. Monitoring, treatment, and veterinary care. After removing a tick, your job isn't done. You must monitor your dog closely for signs of tick-borne illness over the next several weeks. Keep an eye out for fever, lethargy, loss of appetite, joint swelling, or sudden limping. These could indicate Lyme disease or another infection. If you notice these symptoms, contact your veterinarian immediately. In some cases, vets may prescribe antibiotics such as doxycycline, which is commonly used to treat Lyme disease in dogs. Your vet may also run blood tests to detect tick-borne pathogens, especially if your dog was heavily infested or lives in an area where tick-borne illnesses are common. It's also important to treat the environment. Ticks may hide in your yard, carpets, or bedding. Wash your dog's bedding in hot water, vacuum frequently, and consider yard treatments recommended by professionals. Prevention should also be a priority. Monthly tick preventatives such as chewable tablets, spot-on treatments, or tick collars are highly effective. These medications not only kill ticks that attach, but also reduce the risk of disease transmission. Always consult your vet before starting a preventative to ensure it is safe and appropriate for your dog's size, age, and health status. By combining vigilant monitoring, quick veterinary care, and preventive measures, you can drastically reduce the risks associated with ticks. For more trusted health advice that keeps your pets safe, subscribe and join our community of caring pet owners. Long-term prevention and building habits. The best way to handle ticks is to prevent infestations before they happen. Long-term strategies include using vet-approved tick preventatives year-round, especially in high-risk regions. Many pet parents mistakenly stop treatments in colder months, but ticks can survive in mild winters and still infect dogs. Along with medication, environmental management is critical. Keep your lawn trimmed short, remove leaf litter, and create barriers between wooded areas and your yard to reduce tick populations. When hiking, stick to cleared trails and avoid tall grass or dense brush. After outdoor activities, always do a tick check on both your dog and yourself because ticks can hitch a ride indoors. Education also plays a role. Understanding your local risks is essential since different regions have different tick species and disease prevalence. By making tick checks and prevention part of your daily and monthly routine, you protect not only your dog but also your family, since ticks can transmit diseases to humans as well. Potty training, leash walking, grooming, these all become easier when you build habits, and tick prevention should be treated the same way. A daily expression of care that ensures your dog's health and happiness. Potty training makes your home cleaner, but tick prevention makes your dog safer. It's all part of raising a healthy companion. With awareness, diligence, and consistent prevention, you'll give your dog the best protection possible. If this guide gave you the knowledge you need to protect your dog, be sure to subscribe for more long-form, researched pet care videos.